I'm Dr. Greta McLaren, and I'm here at my clinic, Skin Secrets, and I'm wanting to talk about bioidentical hormones. Now, we've heard a lot about this in the news, and a lot of women are on it, and a lot of women aren't. And then there's men that also probably need supplementation, but sometimes it's just confusing as to, do I need it, not? What symptoms do I have? What are the benefits? What are the risks, etc.? We're going to start with the most commonly asked questions about bioidentical hormones, and hopefully by the end of this, you'll have a lot more information to make your own decision as to whether you think you should be supplementing. Okay, we'll start with the first question. So we all heard about this study. It was called the WHI study, Women's Health Initiative. It came out years ago. It really put a dent in women using hormones, because that study, of course, showed an increased risk of cardiovascular disease, breast cancer, different side effects and problems. So everybody was afraid to be on hormones after that. However, if you really looked into that study, bioidentical hormones were not used. In fact, mare urine or Premarin was used, and then a synthetic progesterone called Progestin or Provera was used. Now, those two products do not mimic our natural hormones in our system. So we don't really believe now with bioidentical hormones, none of the studies show increased risk of cardiovascular disease or stroke or breast cancer. So that's why it's taken so long to get back, because sometimes you have a big study that is simply wrong. So let's talk about what is a bioidentical hormone. Okay, so think about, you've got hormones in your system and it hits a receptor and they fit perfectly because you're producing your own hormones. Let's make a bioidentical hormone. That means it is a hormone that is an identical match in terms of fitting, like a puzzle piece that fits perfectly into that puzzle. So the bioidentical hormones work just like your own natural hormones, and that's why it is rare to see the side effects and we don't see the risks associated with them. So the bioidentical hormones are usually estrase, estrogen, testosterone, progesterone, but progesterone is usually micronized progesterone, and it's often called prometrium or just micronized progesterone. So a lot of times they're administered with a cream. So patients often will take a cream and they'll put it on every night. And we're talking the testosterone creams, progesterone creams, and estrogen creams. Another way is a patch, and a lot of women like to wear the patch. I find a lot of women, however, that patch comes off, it doesn't stick, and then it leaves a sticky residue afterwards. So that's not my favorite. Then there's pellets. Now, pellets are easily put in underneath the skin. The nice thing about them is they're so convenient, because you put them in, you forget about them, and they're in your system working for you for anywhere from 3 to 6 months, on average 4 months. Men who use testosterone love that, because they just put it in, forget about it, and of course we monitor your blood levels after that. Women, often the pellets are both an estrogen and a testosterone product, and I'll talk a little later as to why women need testosterone. But we put the pellets in for women, and again, they can pretty much forget about it if they want to. So we here only use the pellets or the creams. Now, progesterone's a different story. Progesterone is actually usually administered in a pill or a tablet. It's usually taken at night before you go to bed every night. This is for women because it can really help with mood and for sleeping. So actually, compounded bioidentical hormones are not FDA approved. Why is that? To get FDA approval on a product, it takes a lot of money and dollars. Pharmaceutical companies do this. They spend millions getting FDA approval, because then they're going to spend millions charging the patients for these products. So you can get a certain product that is FDA approved, like the Prometrium pills, but for the most part they're not. That doesn't mean that they aren't good. That doesn't mean that they're not well studied. It's just that the compounding pharmacies takes a lot of work to make bioidentical hormones. but it's still a very safe product to use. Okay, so let's start with testosterone. Men, and I believe all men over the age of 50, should have their testosterone levels checked. Why is that? Consider the fact that when you're younger, of course you produce a lot of testosterone. Just like with women, the way our hormones wax and wane, so do men. So men can have their testosterone checked even if they have no symptoms. And why is that? You have to understand that testosterone can increase your muscle mass, it can help your bone health, it can help your visceral fat so that you lose weight and you have a more lean body mass. It increases energy, it increases your good mood, it's great for cognitive health, and it helps brain health. Probably the most common reason men use it is also for libido, because you can start to really wax and wane on your sex drive as you get older. Well, the good news is it's a simple blood test. So if you have symptoms, you should definitely have it checked, even if you don't have symptoms. We can tell with your blood work where your levels are, and we can try to optimize them. Most of the men like to use either the pellet that's going to last 3 to 5 months, or they like the cream and they simply apply it to their inner thigh area every single night. Let's talk about testosterone for women. Oh my goodness, women really need testosterone. You know, it's taken us years. I started at the University of Colorado 20 years ago trying to bring testosterone to the forefront. Look, we produce testosterone as women, but as we age, the testosterone levels go way down in us, right? It can affect us in a lot of ways. Obviously, libido and sex drives is number one, but it can also be your energy, it can be your mood, again, it can be brain health, it can help with, your cognitive disorders. Very important to understand that these different hormones that are doing all these good things for you, why would you suddenly just not need them anymore? I really believe it's because we're all living longer, and so we've all thought, well, without hormones, we're fine. But I don't know that in the old days we were meant to live to be age 80 or 90. So it makes no sense if we're trying to have increased vitality and quality of life that we don't supplement. Testosterone has been one of the most home run procedures for women because they feel so much better. Again, pellets or creams are usually the way that we put them in. And women will tell you how much better they feel, and it's usually an energy, a mood thing, obviously increased libido, but I think it's really important to say that women also need testosterone. Let's go to estrogen, clearly for women, right? When you're going into menopause, here's what happens. You're perimenopausal, you're in your 40s, your estrogen's going really high, really erratic, and your progesterone's falling. That really triggers mood disorders. It also can easily trigger migraine headaches, and you don't know that's what's going on because you're still having regular periods. So in your 40s, if you're symptomatic, you should definitely have your blood work checked. Of course, we all know as you go into menopause, now you've got hot flashes. You may have mood disorders again. There's all kinds of things that can happen, and the big one is osteoporosis. So estrogen is extremely important to supplement in women. And let me tell you the studies on this, okay? We talked about the WHI in the past, but the current studies show estrogen actually decreases your risk of cardiovascular disease. It actually does not increase your risk of breast cancer or blood clots. So it's very important to understand why your body, when it's using the natural estrogen, it can be very beneficial for you. In the past, we were always taught in medicine that if someone had a hysterectomy, they no longer needed progesterone. Why is that? If you have estrogen and you don't balance it with progesterone and you still have a uterus, you can have an increased risk of endometrial cancer. So all these women who had hysterectomies were never put on progesterone. But now we know every woman should be put on progesterone because it affects receptors in the breast and it actually helps protect against breast cancer. So whether you've had a hysterectomy or not, you should consider progesterone supplementation. Progesterone can really help with sleep. That's why it's usually taken at night before you go to bed. So a lot of you have heard about DHEA because you can supplement it over the counter. It again is a hormone that decreases naturally as we age. It can help with mood. It can help decrease your visceral fat being that fat inside underneath the muscle around the organs that increases risk of heart disease. It can also help memory, osteoporosis, and also enhance sexual vitality. I think one of the most important things that we're seeing with DHEA is for women, if you supplement some DHEA in the vaginal area, or sometimes just use something we call a troche, it's like a little pill of DHEA, and you put it up into the vagina, it can really, really rejuvenate the vaginal tissue, especially if you combine that with some estrogen. So you can pretty much think that as we age, the vaginal tissue really starts to atrophy, right? It gets thin, you don't have enough lubrication. That is precisely what both the DHEA and vaginal troches can help with. But then, of course, just supplementing with your progesterone and your pellets of estrogen and testosterone help as well. But we are big advocates for also using DHEA in some patients who have signs of it being low, and we can check that level on you as well. Okay, I think for years thyroid has not been managed well. I'm not sure exactly why, but we still don't really optimize thyroid in most medical clinics, although a lot of us who really do optimize it see big improvements, all right? So when you're doing thyroid, I just constantly hear somebody is on thyroid medication, but they're still gaining weight, they're still fatigued, they still don't feel well. There are a certain number of tests you need to do with thyroid to really find out what's going on with your thyroid. So you don't just check the TSH, which is the regulating hormone that helps you secrete the thyroid. The T4, which you produce, has to then get converted to T3, and if you don't have the mechanisms in your body to do that, you can have a decent T4 level, but your T3 level is not high, so you're still not feeling the improvement from the thyroid. And then there's all kinds of binding proteins to your thyroid, so we have to check those too. So I think it's really important to have a full workup for thyroid, and we do that here as well because it's very difficult to optimize hormones in terms of estrogen and progesterone and testosterone if your thyroid is off. Not to mention fatigue and weight gain, none of us want to put up with that. So we do optimize your thyroid here as well if that's something that you need. Okay, so obviously I'm passionate about hormone supplementation. I feel like it is being done well in some regards and not so well in others. We do not do the BioidentiCal program here. I'm going to explain that because that is more of a one-size-fits-all sort of program. We really look at the metabolites and which pathways you're going down from a biochemistry standpoint, and we try to optimize your hormones for you. It's not a one-size-fits-all situation. I'm Dr. Greta McLaren, and I hope that everybody can restore their vitality and quality of life, and we are more than happy to consult with you here. Just call us at Skin Secrets.